First things first, is the scene safe? Yes, it is. Patient, hazardous environment, brings the patient out into safe zone. Now treat patient. We have a 50-year-old patient who is having an environmental hazardous problem. The patient was sleeping, and the patient was having a hard time breathing. His chest was hurting, and it was because of a gas leak. Therefore, we brought the patient out from the hazardous environment, and now the patient is in safe zone, and we will administrate oxygen. While that's happening, we would take vital signs, and the patient's blood pressure is 115/70. The patient's pulse is 60. The patient's respirations is 16, and the patient has been deoxified. That's important before you bring in the patient to the hospital, that you detoxify the patient, because you don't want to bring that into the hospital. And the patient has a history of asthma, doesn't have an inhaler with him, he has too many medications to name. For the ambulance assessment, we would say we have a 50-year-old patient, male. Patient was sleeping. It's a case of environmental hazards, gas leak. Patient was having trouble breathing, chest was hurting, vital signs over 115/70, pulse 60, respiration 16. Oxygen was administered. Patient has been detoxified. History of asthma, and doesn't have an inhaler with him. Various medications, but does not remember what kind, and they're not in hand.